Well, I think all treatment for cancer can be varied in terms of toxicities. I mean, I think of some of our more common chemotherapy recipes. One in particular is a combination of carboplatin and a drug called pemetrexed, or Alimta as its trade name. Now, there's an example of a recipe that is as effective as most recipes in terms of chemotherapy for lung cancer. But I tell patients, look, here's a recipe that takes about under an hour to receive in the clinic. You can eat, you can sleep, you can watch TV, you can talk with your family in a chair, and then you got to come back in 3 weeks for your next dose. You won't lose your hair, you shouldn't get sick with it, and it can lower your blood counts, but we'll be watching you carefully. I then look at pills, things like erlotinib or crizotinib, and I think patients and sometimes doctors, my colleagues, will think, oh, that's got to be easier than even that recipe. But we all know that even pills can be toxic or have side effects that sometimes are worse than chemotherapy, medicine that goes in through your veins. I tell patients everything has a potential risk. I generally view the approved agents like crizotinib and erlotinib as very safe, and I think when they first came out, if you were unfamiliar with these drugs, it can be a little bit of a challenge in terms of managing side effects, but as patients and doctors get more familiar with using these agents, we get a little bit better at managing things like diarrhea and skin toxicity, or even some vision changes that can occur with each of these agents. So I think everything has side effects, and it's not as easy as drinking a glass of water or taking an aspirin, but you have to be aware that everything could have some risk with it. It's not, unfortunately, without risk.